People are terrified of making the same mistakes that we made in psychiatry with same-sex attraction. Homosexuality wasn't even taken out of the DSM until the 70s. And then there was this residual diagnosis about discomfort with your sexuality that was still in there till 1980, I believe. So for good reason, clinicians and doctors and mental health professionals are very careful not to dissuade somebody if that's really truly who they are at their heart. We do not want to harm kids who are just developing and discovering themselves. But what's happening today is kids are conflating having some discomfort around your gender in certain circumstances with the idea that, well, I've always been this way. And so kids will say, it's true that I never was dysphoric as a kid, but it's just because I wasn't thinking about it. Now that I'm thinking about it, I realize that I was dysphoric.
Welcome to episode 5 of the Unspeakable podcast. I'm your host, Meghan Daum. My guest this week is Sasha Ayad. Sasha is a licensed professional counselor who has treated adolescents for more than a decade and whose work focuses on teens and young adults struggling with issues of gender dysphoria and gender identity. Now, if you're familiar with this subject and with some of the discussion around it, you may know that it's become highly divisive among clinicians and even more highly charged within communities of trans activists. In this interview, we talk about some of the reasons for that, as well as some of the reasons there's been a dramatic uptick in the numbers of children expressing trans identities in the last few years. On a technical note, I want to say that this interview was recorded back in June when this podcast was effectively in pre-production and I was still figuring things out on the audio quality front. So if you have a picky ear, as I do, please know that this is a process and I'm hoping to get this show sounding pristine before too long. Sasha Ayad, thank you so much for speaking with me. I'm really, really excited about our conversation, especially because I think we read a lot about these issues that we're going to discuss, but we don't hear as often from actual clinicians, people working with actual clients and patients. So I was hoping you could just sort of start off by telling us how you got into working with adolescents, what's changed over the last couple of years, especially vis-a-vis this gender identity situation that we found ourselves in. Just sort of tell us what it's all about.
Thanks, Meghan. I'm really glad to be on your show. Thanks for having me. And you hit the nail on the head by lifting up the term gender identity. So I'll get into that. But I've been working with teenagers and adolescents for over 10 years. And before I started working specifically with gender dysphoric kids, I had kind of a broad range of experiences. So I worked with victims and survivors of sexual abuse and domestic violence, teenagers as well. I worked with autistic kids. I worked with adults who have intellectual disabilities. And then more recently, I was a middle school counselor at a charter school. And around 2014, while I was working at this school, I started our campus's first GSA, or Gay Straight Alliance. And it was a pretty conservative parent population, and I knew some of my middle school kids were questioning their sexuality. So I wanted them to have a place where, they could do that in a way that felt safe and confidential. So during these GSA meetings, what I was noticing is a lot of the teenagers were using terms that I was unfamiliar with as a trained clinician from my graduate program and from all of my work in psychology. So they were saying things like gender identity and non-binary and agender, and they had all of these sexuality labels that I had never heard of before. And at first I thought, well, maybe this is just an evolution of terms, like what I might have called a tomboy. Maybe that word is out and non-binary is just a substitute term. But I did get curious. So I went online and started researching this idea of gender identity, and I found a couple of things. First of all, I found news stories and kind of media articles that were very celebratory about transgender children. And these were kind of very hyped up articles about bravery and how great it is for kids to be their authentic self. And that was like this very glamorized version. But then I found on the other side of that, all of these parents, concerned parents, reporting that their child, who had no gender issues as a kid was suddenly announcing a transgender identity around adolescence. These stories were about mostly female kids, and a lot of them were coming out in peer clusters. So it would be like a whole friend group of girls identifying as boys within weeks of each other. Or kids who would spend the summer online, when they weren't in school, they had more downtime, and they would spend the summer researching transgender issues, watching YouTube transition timelines that show somebody transforming, over the course of months on testosterone, years on testosterone, and then at the end of summer, kind of coming out to their parents. And in all of these parent reports, people were saying, it sounded very scripted, what she said to me about gender identity. She was using all of these words that I think she got from the internet. And, I thought at first, well, this would be fine if this was just an identity exploration, right? Because that is a part of adolescence. But these kids were also making kind of demands about things like changing their name at school, wearing a breast binder, getting hormone replacement treatment, and then top surgery, which is mastectomy. And so I thought, whoa, there's something really important going on here. So the next thing that really troubled me was, at this point, I've consulted with about 400 families. And so I've heard these stories for myself, not just anecdotes on the internet. But what was really troubling was that when parents would take their, for example, autistic daughter to a therapist after she makes this announcement, thinking, okay, well, she'll get properly assessed. They'll try to explore what this means to her and, see if maybe she's conflating like her romantic attraction to girls with gender identity, or just have a proper assessment of what's going on. Clinicians and professionals were just saying, no, you have to agree that your daughter is now your son.
I want to actually back up a little bit here, just so we have some context for the population you were actually working in. I meant to mention this in my introduction. You are currently based in Houston, Texas. Is that right?
Correct.
Okay. And so when you were working at this charter school, I'm assuming it was not necessarily in some hyper progressive place. It was not in Park Slope, Brooklyn. It was not in Palo Alto. Maybe it was. But can you just sort of tell us where you were? And also, I'm curious where you were reading these articles that were kind of turning this phenomenon into a trend story. Like, I'm trying to think 2014. So are we talking about like the cover of Time magazine? Like, what do you remember exactly, just sort of about the media, the sort of zeitgeist around all of this?
When I was working in this charter school here in Houston, you're right. It was not specifically a progressive school like some of the schools you see in the Northeast or even in the West. However, the school was starting to take more of a social justice activism angle in the way it thinks about policy and student support and those types of things. Our school was not yet experiencing a lot of kids who are gender dysphoric or questioning their gender. I think at the time, out of 13 campuses, there were maybe 4 kids who were raising questions about their gender identity. But what I was noticing is that these stories that I was reading online were coming from, well, the positive stories that were really celebratory were coming from a lot of the mainstream publications. I remember the National Geographic published a magazine called The Gender Revolution with the image of a young transgender child on the cover. We were seeing some celebrities talk about their trans kids. But really, I think there was a lot of discussion of trans issues when Caitlyn Jenner came out as trans. So I was seeing these kinds of stories all over the place, and very few mainstream publications were raising thoughtful questions. Even though the clinical population, anyone who's working in the field, when you see numbers like this, like we see an increase in over 4,000% of children seeking help with gender identity issues, any clinician would kind of raise an eyebrow to that. But of course, in the media, we weren't seeing any nuanced pieces until more recently. Specifically, I think the Atlantic article that Jesse Singal wrote was a really big kind of eye-opener for some people. But back when I was starting to notice, got a lot of trouble for that, didn't he?
Yeah, I was going to say he got a lot of pushback for that. And I want to touch on that side of things in a little bit. But I mean, when you say a rise of 4,000% increase, you're talking over how much time? Like from what year to when, would you say?
So those numbers are not coming out of the US. Those are coming out of the UK. So in the UK, there's the NHS Gender Identity Service. It's like a centralized healthcare service that sees children with gender issues. And so between 2006 and 2016, they saw an increase of over 4,000% in kids under 18 seeking help with gender issues. And the majority of those were teenage girls.
Okay. So you're working in the school, you're working with these kids. Are they actually coming to you and talking to you? How is this actually playing out?
So I was kind of having these two parallel processes. I was seeing, these stories online from parents, but then in my school, a couple of female kids that I knew very well that I had already worked with for several years, they started describing, questioning whether they were girls or not. So again, I was noticing the same thing. When we would talk about these things, they had all of this language, like a brand new lexicon that was definitions and terms and what things are transphobic and what things are not transphobic, and all of this kind of rhetoric that they were using to try and describe what they experienced as questioning their gender. So what really, I started to notice that they may be describing ubiquitous teenage experiences under different terms. So, I mean, I don't know if this was your experience, but when I was a teenager, my body was changing and I felt very uncomfortable with any part of me that signaled I'm female.
Yeah. And actually, I was going to ask you, how, you don't have to tell me exactly how old you are, but how old are you roughly? What generation are you part of? How do you identify generationally?
I identify as someone I'm at the end of my 30s. I'm 38.
Okay.
So when I was growing up, because I know you've done a lot of work around generational differences, and I think that's really interesting because I do see there being a lot of generational issues here. But when I was growing up, I didn't have a cell phone. I had a pager when I was in high school, I think, and then a flip phone. And right. How much damage can you do yourself?
And you weren't a drug dealer, and you had a pager, right?
You never know, Meghan. I mean, I might have been dealing drugs.
Yeah, you got to moonlight somehow. Yes.
Yeah. So I think what I really realized about working with these kids and having spent a lot of time, listening to how they formulate their issues and how they understand what they're going through is that when they have a discomfort, they turn to the internet for answers. Whereas when maybe I had a discomfort in my teenage years or you had a discomfort, you either bottle it up or you talk to your friend about it or you journal about it. And you have to essentially make sense and make meaning out of it yourself. Sure, we had teen magazines with, silly quizzes of like, answer these questions and we'll tell you what kind of a kid you are. So, I mean, we had similar, ways of trying to make sense of our experience, but we did not have, an outsourcing of our psychological development to the internet. And
that is so interesting.
What we have now.
And also when we journaled, we didn't do it on Tumblr, right? We didn't do it online. Exactly. It was private. Nobody was reading it unless our mother was secretly reading it. So yeah, we didn't have a comment board on our own diaries. Mm-hmm. So yeah. Okay. Interesting. Mm-hmm. So these kids, they're having a sort of a constellation of identity questions and confusions, and they're going to the internet to seek meaning and answers. Mm-hmm. Mm-hmm.
And I think what's important to note is that a lot of times the identity questions come later. So in my experience, what I see is that kids are, maybe they hear a term. So a lot of times they'll be like, oh, my friend came out as trans and I had never thought of that before. And so I wanted to be a good ally. So I went online and started researching trans. And what information you get today about what is, if you were to Google, what is transgender? You're getting a very, very different set of ideas compared to even when I was in grad school, a decade or so ago. that is so broad, and this is kind of like the concept creep that Jonathan Haidt and Lukianoff talk about. The concept of what it means to be transgender in today's youth culture online is very, very broad. So here are some of the typical things kids will find when they look up, am I trans or what is trans? Only you know if you're transgender. Transgender does not have anything to do with how feminine or masculine you are. Transgender means that you're uncomfortable saying that you are the sex that you are. So think about just those three. I mean, I could share more of the kind of markers, but those three ideas are so broad and almost meaningless. And what I mean by that is, if you ask a transgender person who came out and transitioned before the early 2010s, in my experience, what you'll find is people who had a very clear understanding of what their dysphoria meant. Their dysphoria meant that ever since they remember they could walk, talk, and breathe, they were pretty certain that their body was the incorrect sex and that they wanted to be something concrete. They wanted to be the opposite sex. But what's happening today is kids are conflating having some discomfort around your gender in certain circumstances with the idea that, well, I've always been this way. And so kids will say, it's true that I never was dysphoric as a kid, but it's just because I wasn't thinking about it. Now that I'm thinking about it, I realize that I was dysphoric. So it sounds subtle, but it's really, really important of a distinction. So we've just kind of broadened the category so much.
And do we see that sort of thought process more from natal females, from girls coming in and saying I'm trans than boys? I mean, one of the sort of, one of the characteristics of what we're calling ROGD, or rapid onset gender dysphoria, is that we are seeing it more in girls. And I guess, I don't know what the numbers are exactly, but it seems like traditionally when we talked about transsexuals, as the term used to be, it was far more, there were far more men transitioning to, natal men transitioning to female than the other way around. And I have a couple of theories as to why that may be, but before I submit them to you, what are the kinds of things that these girls are actually coming in and saying to you? Like, typically what goes on at an initial meeting with a client? Like, are the parents there? Has the kid come in of her own volition? Like, how does it go down?
So there's a couple of questions packed into there. So yes, you're right about the sex ratio reversal. So prior to about 2007, maybe 2006, most children who develop gender dysphoria or want to change sex are male. We saw that start to switch around this time. And what I often hear, parents who contact me, by definition, contact me because they're quite flabbergasted by their daughter's announcement that she's really a boy. So I lift that up because I'm guessing there are some families who have always had a pretty masculine daughter. And if she announces trans, maybe they don't feel surprised by it. Now, I still hold reservations there because another thing that we all know, we know this intuitively and we know this scientifically, that many adult gay people and lesbian people question their gender in childhood, especially around puberty. Maybe not outright, maybe not standing up one day and saying, Mom, I'm actually a male. If you talk to adult lesbian women, they will describe really feeling conflicted about being girls. So anyway, people who contact me are parents whose kid was always very kind of typical in her femaleness. Stereotypes aside, she just never complained about her gender. She never really brought it up. So when they hear this trans announcement with usually a checklist of to-dos that she wants to change her name and cut her hair and bind her breasts and all this stuff, they become, of course, quite alarmed. And so they'll go online and research, gender dysphoria or teenager announces trans, and they will fall into kind of two camps of clinical perspectives. Right now, the American Psychological Association and the American Pediatric, the the Endocrine Society, all of these large organizations have taken up this idea of affirmation, which is if your child says this, you have to agree with them. So when parents go to a therapist or a doctor or their pediatrician who's known their kid their whole life, they often feel quite surprised when they say, no, well, you have to go along with this or else your child is in danger of suicide. So I just want to kind of frame this for anybody who's listening because this is a very unusual time. We've seen things like this happen before in psychiatry with eating disorders that like all of a sudden spread in big numbers. And there have been times when we see a certain condition just kind of explode in the population. But to affirm it without assessment is really problematic. So my approach is to do kind of like old school individualized treatment and really assess what is going on for this child. So I'll just kind of pause there.
And I just want to make clear, wait, so Sasha, I just want to make sure that like our listeners know you are in no way denying the existence of trans people. You are not anti-trans. I assume that you have worked with kids who are trans and went on to transition and happily so. So let's just make clear, because I think it's really easy to, paint for certain corners of activism are ready to sort of paint anybody who questions any part of this kind of approved narrative at this point as transphobic. And that's like completely inaccurate and unfair. So let's just be clear about that. The parents are not coming to you because you're going to talk their kid out of it necessarily.
No. The parents are coming to me because they have a feeling that something else is going on. And I think you're right to lift up this question of activism, because most trans people that I've met, most people who have successfully transitioned, don't find anything that I'm saying controversial.
Right.
What I'm saying is based in, clinical standards of best practices. So my approach is to, first of all, assess the symptom development, the development of dysphoria, and try to understand what it means. So, to answer your question about what does it look like when I'm working with a patient, I stay really curious. So I encourage kids that I work with to remain curious about what their experience has been with gender, what feels comforting or relieving to them about their gender identity, and trying to understand, what this dysphoria can mean in the context of their lives. I don't really challenge kids per se on what they are sharing with me, but I do take it into a holistic picture of everything that was going on in the child's life, in their social relationships, in the context of other mental health conditions that they might have, and trying to help kids resolve other issues while we are staying curious about their identity and what that means.
And what are the other issues? Is there a typical cognitive profile of a kid who comes in and says they're trans? I mean, we know that there's some overlap with autism spectrum. Is that right? Can you talk a little bit about that? How do these things get sort of tangled up?
Autism is really overrepresented amongst young people right now who are seeking transition. And again, I think using the word trans versus gender dysphoria makes it hard for us to speak accurately about these cases. So if you were to say to me, Meghan, this is a transgender child, what does that mean? What is the kind of meaningful understanding we can extract from that? Well, it's really hard to say. First of all, is that a child who's been claiming that they're the opposite sex ever since they were 3? Is that a child who just started saying that yesterday and threw away their entire closet just, this hour? So the word transgender child creates some sort of confusion because we don't really know what it means. I prefer to talk about kids who are experiencing gender dysphoria.
Okay.
Because that doesn't preclude us from working with the distress that they're having.
And what kind of distress do you tend to see? Like, are there patterns? Is there a certain kind of family structure? Are there certain sort of cognitive traits, interests, even sort of aesthetic predilections. I'm always curious, like, what is the deal with anime? There's like this connection between anime avatars and, sort of non-binary people on social media, I've noticed. And maybe I'm just sounding like an old person and I'm not getting the nuances, but maybe you could, you could enlighten me.
There are a couple of things that I tend to notice. So many of these kids are dealing with a lot of anxiety. So some of them struggle with social anxiety and maybe don't have that many close relationships with peers in real life. So lots of these kids have developed social circles largely based on the internet. And, around that age, kids are into video games, they're into anime, they're into fan art. And there's a lot of playing with fantasy ideas, fantasy images, and, fantasy characters. So I do see that a lot of young kids start to get enamored by these anime images, which do have some kind of gender bending characters and characters that play with their gender presentation or their sexuality. So there's a lot of fantasy material, especially among the anime kids. And when it comes to autism, I think part of the reason there's such a high representation of autistic kids here is because there are some traits that autistic kids tend to exhibit, such as hyperfixation, getting kind of obsessed with one or two ideas and ruminating on it over and over. Kids on the autism spectrum also struggle with black and white thinking. So understanding nuance and the gray areas of life can be really challenging for them. And they also struggle socially. Autistic girls in particular have a bit of a different profile than autistic boys.
Right.
And, historically we've thought, well, autistic boys, they're kind of asocial in that they don't really care about friends and that sort of thing. Well, that's not necessarily true. And it's even less true for girls. So autistic girls really, really want to connect with others, but they have a hard time reading social cues and being able to kind of follow the more subtle ways that girls interact. And being a teenage girl, there are so many kind of baffling, subtle rules that are really hard to keep up with. And whether you have autism or not, I think there are lots of young girls who just don't care for, I guess, the quote drama of being a teenage girl and some of the kind of petty infighting. And, I hate to say that because it's a stereotype. And we also know that being a teenage girl, you do all of a sudden become subject to these kind of social sabotage behaviors and all of the complexity of, female adolescence.
Right. So this is, I'm thinking out loud here. This is really interesting. So, you sometimes, we associate autism with a sort of extreme boyness in a way, a sort of, these are stereotypes, sort of, this aloofness, lack of interest in socializing, or, all the things that you just described. So I can imagine how if you are a girl and you're on the autism spectrum and you have these traits, you can start to wonder if you're actually a boy, because maybe female manifestations, the way autism manifests in females is just not something we talk about as much. It's not something we're familiar with. So if you're a girl and you're sort of, falling into these categories, is it easy to just say, well, this must be what it is. I'm actually a boy. And it's because we don't have the vocabulary to actually talk about the spectrum with enough complexity.
I think you're right. Well, it's true that kids on the autism spectrum tend to be not really that conforming to gender. Part of it is because they're not as good at picking up on those kind of subtle social cues of like how girls typically behave or whatever. So we do see a lot of gender nonconformity in autistic girls. But
and in boys also, though, are you saying I hadn't thought of that. So would you say that's just sort of true across the board? Gender nonconformity within boys and girls?
Yes, but not so much in the way we think about it today. So if you were to ask, let's say, a 16-year-old today, what does gender nonconformity mean? They're going to talk about clothing. If you ask somebody from my generation or your generation, we're talking about the spectrum of masculine and feminine behavior, mannerisms, personality traits, how people carry themselves. So there's been a really important shift in concepts and language. And I just want to lift this up because I think for any listeners who may be kind of thinking, well, is Sasha saying that people, just all these people who have gender dysphoria are confused or they're making it up? I want to be really, really careful.
No, our listeners are smarter than that, but yes, but go,
Okay.
do clarify yourself just in case.
Okay. So if we were to think about what does the term gender dysphoria mean? What does the term gender identity mean? What does the term transgender mean? I think if we explore that a bit, it will really help us to get our minds around what is going on right now. So gender dysphoria is the condition that someone experiences a huge disconnect between the sex they want to be or the sex they believe they are and their biological reality. Gender dysphoria typically presents very, very young. It's consistent. It is obvious to anybody in the life of that child because they are making statements about it. They are explicitly calling themselves the other sex. I mean, it's impossible to miss. At least that's the clinical presentation we have data on. That's what we've always known. So gender dysphoria is, of course, a conflict between a person's experience of themselves, which I believe to be genuine. I don't believe this to be, I don't want to call it a mental illness because I don't really think it's exactly that. But there's a fundamental disconnect between what a person's internal sense of self is and what their body is. Now, if a person is experiencing gender dysphoria, one way that they might cope with it is by taking on a public persona as the opposite sex and trying to socially and medically transition to live in that other sex role. Okay. So what I have just said would be very much a non-controversial statement by most trans people, most clinicians who've ever worked with dysphoria. So none of this is controversial. What I'm about to say is the controversial piece. The inclusion of the term gender identity has really muddled the waters. And here's why. Gender identity is a theoretical concept that we've kind of created to try and give a post hoc explanation to a transgender person's experience. So let's say we take that dysphoric child and we follow them through up until adolescence. We know that 65 to 90% of dysphoric children will outgrow their dysphoria and realize that they are gay, lesbian, bisexual, and sometimes straight, but more often than not, gay, lesbian, or bisexual. And after puberty, they will feel less dysphoric as they solidify their sexual identity, okay? But let's say we have that smaller percentage of dysphoric children who do not grow out of their dysphoria. Those are children who historically might start a transition process in their late teens or adulthood years, and they are trying to live in the sex role that they feel themselves to be. So that process involves a social transition, a medical transition. And I think at that point, it's fair to say, once a person has really embarked on this transition process, at that point, it's fair to say, well, this is a transgender person. Mm-hmm. What we don't know using the term transgender is whether or not that person will stay satisfied with their transition. So any clinician who's worked long-term with these patients can tell you it's impossible to predict which dysphoric person will continue to benefit from their transition. So that means we kind of have this open-ended, clinical presentation where maybe a person is really happy. They're much more comfortable after transitioning. But for some people, for whatever reason, sometimes that doesn't seem satisfying in the long run. So what's happening, the term gender identity is this theoretical way to try and explain the experience of a transgender person. So we're now saying, well, actually, the whole time, they just had a different gender identity, rather than saying this is an individual who's treating their dysphoria. And that is really confusing because if you say, well, this person has always had a female gender identity, then that means even when this was a 3-year-old boy, he was actually a female. When he was a 5-year-old boy, he was actually female. And now he's maybe a 30-year-old transitioned woman, and now he's female and looks very female. But if you say that the gender identity has always been true at every single point, then we are now in the territory of treating gender identity issues, trans issues, the same exact way as we would treat homosexuality.
And has this come about because of the nature of the activism around the trans movement? Is it because what you have just summed up? I mean, you did so very concisely, and it's clear to me, but it's a little bit complicated, and it's the kind of thing that's hard to sum up in a hashtag or in a slogan or in one sentence. Or the nature of activism is that you have very clear messages that are powerful and sort of grab you by the collar sometimes. So what do you make of the sort of sensibility around the trans activism? Because I was thinking earlier, there's the in group, the sort of social drama of just regular girlhood is bad enough. But I think that a lot of what we see in trans activism is beyond that by order of magnitude. So can you talk a little bit about what you've seen in that realm?
Sure. It's been really interesting to watch so many establishments that are meant to treat mental health conditions and medical conditions taken over by an activist narrative. It's really been something for me to see in my young time as a clinician. But it's really impossible to think about gender dysphoria, the condition, without feeling a lot of intensity around it. Because if you imagine what it might be like to really feel like your body's incorrect, that is a distressing experience.
Yeah.
So I think part of the narrative that activists are pushing is meant to sanitize the discomfort of gender dysphoria. So if they can just say, well, no, it's just a type of gender variance like everything else. And just like how there are people with different sexual orientations, this is just a wonderful, beautiful part of the rainbow. It just makes it a lot more palatable, and people don't have to think about how distressing it might feel to experience gender dysphoria. I think that is part of the reason behind this push. I also think for the much bigger portion of people who are yelling online with hashtags, they've just been captured by this very dogmatic idea that there's only one correct opinion to have here. And there's so much hyperbolic language around this discussion. There are a lot of, words are literal violence. And if you say this, you're literally killing trans people. And just so much inflammatory messaging around this that people don't really feel they can speak up. I mean, there are researchers and clinicians who have been just blasted for asking really good clinical questions. Dr. Lisa Littman, who published her research on rapid onset gender dysphoria, had just a huge kind of campaign against her paper, and it got pulled back and then reviewed again. And so even the clinicians who worked for decades in this field, like people like Dr. Ken Zucker and Ray Blanchard and Bailey, and they have been attacked and pushed out of their own fields, essentially. So it's not surprising that things have gotten ramped up really fast when even the most educated clinicians are not allowed a voice in this debate.
And what goes on in the offices of those clinicians who are sort of going along with this party line? I mean, we hear stories about kids getting access to hormone therapy, getting testosterone, for example, without their parents' knowledge sometimes. Is that even possible? And if so, what is the scenario there?
I think people would have a really hard time believing what happens. And a lot of times we see on social media, clinicians like myself or colleagues will raise these concerns, and people who consider themselves allies or kind of activists will say, that's not true. You have to be thoroughly assessed to get testosterone. But unfortunately, that isn't the case at all. So if I were to give you kind of a typical example of a teenager, if they go to a very liberal school that has a policy in place that is meant to protect, I think it's meant to protect LGBT kids from abuse at home, which is, of course, a really noble aim. But ultimately, it really causes problems. So if a kid is starting to question their gender identity at school, they tell their teachers, and they might say, please don't tell my parents. So a kid in freshman year technically could start going by a different name at school and be called the opposite gender for 4 years, and the parents may not know. Or kids can go to informed consent clinics. There are some clinics where they can sign a waiver to basically like emancipate themselves from needing parental consent in some cases.
The kids can do this when they go into the clinic. And is this a gender clinic specifically, or any kind of clinic? Like, could they get birth control that way, other things?
Mm-hmm. Yeah, this is not all clinics, but I believe in the same clinics that would allow a kid to get a birth control prescription operates in the same manner, and they can get hormones. Now, most often, I'm not seeing things like that happen. I've only heard of a few cases where a minor is getting hormones without their parents' approval. However, with a parental accompaniment to a gender clinic, families are essentially told, your child is dysphoric, but they're not going to assess their background. They're not going to look into any trauma. So, for example, if a child has been sexually abused and very recently started to feel uncomfortable in her female body, clinics feel as though that is completely unrelated to the dysphoria. So they're going to encourage parents to send them down this medical pathway and tell families that, if you don't go along with this, your child is going to be at risk of killing themselves. So it's not so much that kids are going behind their parents' backs and getting hormones. I think it's that the entire process of identity development is not really being explored in a way that considers other factors or other underlying issues, or just the fact that kids are kind of steeping themselves in certain online materials, and that's where they're getting their gender dysphoria or their new identity. And to me, that is really concerning, because we know that adolescents are in a stage of life where they're looking for identity, and they're looking for peer acceptance, and they're looking to kind of question norms. So to say that everything we know about adolescence somehow just gets completely suspended in this population, it just doesn't make sense. And I think it needs to be explored.
It's extraordinary. I mean, I don't know how else to ask this question. I mean, I'll just put it out there. Who are these clinicians? Who are these therapists? Do they go to certain kinds of schools? Do they have a particular kind of education? Do they belong to certain kind of institutes? Like, where do they come from? And how many of them are there? It seems like there are more of them than there are of you at this point.
Much more. I think what typically happens, though, is that the kids are referred to gender clinics. So the first gender clinic opened in the US in 2007. There was one. And now there are like 65 youth gender clinics in the US. So that is a huge proliferation of these medical and mental health clinics that operate based on a philosophy of innate gender identity. So there have been a few kind of key clinicians who are creating training programs and materials. There are organizations like Gender Spectrum and Gender Infinity that are creating these training materials and then going out and training school counselors. Like when I was working at that charter school, really my impetus for kind of raising a red flag there was receiving a training by a advocacy group that came in to talk to us about gender identity. And I raised a lot of questions during that training, because at that point I had already been reading research from, clinicians who have worked with gender dysphoric kids, and really like scientific literature and psychological literature. And what I realized is that this theory of gender identity, it's really taken over medical and mental health care, was so unscientific and unpsychological that I was in this training asking all these questions and raising my concerns, and people were really kind of surprised that I was pushing back against the narrative. But these
people, meaning other teachers,
the other counselors. I mean, I think
The other
people were
counselors.
like saying, "Oh yeah, that is a good point, Sasha." Like I had some people who were engaged, but again, I think people are terrified of making the same mistakes that we made in psychiatry with same-sex attraction. You know, homosexuality wasn't even taken out of the DSM until the 70s. And then there was like this residual diagnosis about discomfort with your sexuality that was still in there till 1980, I believe. So for good reason, clinicians and doctors and mental health professionals are very careful not to dissuade somebody if that's really truly who they are at their heart. We do not want to harm kids who are just developing and discovering themselves. So I think that's the reason why so many organizations have been receptive to this philosophy of innate gender identity. And there are, activist doctors who have, millions of dollars of grant money to study this. In California, there are several huge medical systems and university health systems that have adopted this and are researching this. And, I think most people I talk to, Meghan, share some of our very kind of rational concerns and our awareness that, kids are in flux. Teenagers are developing identity. We should slow things down. The average person agrees with that. Parents who have been through some of these big hospitals that are running these gender identity clinics, the stories I hear from them make me really concerned, because even if they bring their child who's quite young, the advice that they're given is that you have to continue pushing the gender identity, even if the child changes their mind, or even if the child feels unsure.
Even if the child feels unsure, because now it's taken on a life of its own. And this sort of suicide threat has been weaponized.
Right.
Among other threats.
Exactly. So to answer your question about, who are these clinicians, I think there are a handful of activist clinicians who are really pushing this theory, and not only pushing the theory, but advocating for younger and younger transition. And they are essentially kind of creating training programs and working their way into these major medical establishments and mental health organizations to solidify that the affirmative model is the only way to treat these kids. And there's been a lot of pushback. I mean, we can get to this later, but if you're following what's happening in the UK, as we could predict, this affirmation model is not the best way to approach young children.
These clinicians that you're talking about, do they really think that this is so prevalent that it's completely logical that there might be 4 kids in any given classroom who are transgender? Because that's so out of bounds with any sort of logical assumption or premise. Do they think that this is something that's been, part of human life for millennia, and we're only now realizing it and accepting it? Like, how does their logic play out?
I really find it hard to get inside the mind of these activist clinicians, because for me, it seems so outside the realm of possibility that, 30%, like I talked to a family where 30% of the girls in the school identified as boys. However, I have to believe what the activist clinicians are saying. They are essentially saying that if a child, there's a clinician who says, if a child is pulling barrettes out of her hair, that is a gendered communication as a baby that she really may be a boy.
Pulling the bow out of her hair as an infant coming home from the hospital.
As an infant. Mm-hmm. So that is, patently a ridiculous proposition, but there's really a belief. They have a truly ingrained belief that gender is just everywhere, and all of our behaviors, communications, language, our personality traits are somehow gender related. So if you make gender the center of everything, you will see it everywhere. And I really think that is what's happened. It's interesting because when you look at like the multiple personality disorder epidemic a few decades ago, it has some similar traits. It's non-verifiable, right? So you cannot do a blood test or a brain scan to tell if somebody is going to benefit from transition. There's no like test for trans. You can self-diagnose and develop discomfort kind of on your own from reading about it. So this is what happened with MPD. The book Sybil was published, and
I was going to say,
sudden,
how much did Sybil have to do with that?
Yes. I mean, I've started to, in my own attempt to understand what I was seeing in my clinical population, I've had to really think outside of the bounds of, what is gender dysphoria. I've really had to understand what is going on in our broader culture, that there's thousands of girls out of the blue developing these symptoms. And I do think there's so many parallels with multiple personality disorder. There's also interesting to me that with multiple personalities, there were some people claiming to have hundreds of personalities.
Right.
And here we are with the gender identity theory. There are some people that claim there are hundreds and hundreds of genders. Now, I'm obviously not trying to map those two things together with some kind of conspiracy theory like, oh, eureka, However, when you have a completely nebulous definition for something like gender identity, it's very easy for this to spin out of control.
Yeah. And I want to go back for a second to seeing the world, seeing everything through the lens of gender, because, this is something that I've talked about a lot, but I'd be curious to sort of talk about it in this context. So, I grew up, I'm about 10 years older than you. I grew up in the 70s. I was a teenager in the 80s. And at that time, being a girl in the 70s, being a tomboy was cool. That's what you wanted to be. Being a girly girl was like uncool. So like if you were one of those girls that wore, frilly dresses and patent leather shoes, you were Nellie Olson, right? From Little House on the Prairie. I'm really dating myself. Like nobody wanted to be Nellie Olson. They wanted to be Laura, who was like a real tomboy. I always, I've said, like, you look back, who were the biggest female child celebrities of the 70s? It was Jodie Foster in film and Christy McNichol in television. And they both are now out lesbians. And so there was a sort of, they were definitely girls, but they were little girls, but there was a sort of androgynous quality to them. There was something about being a kid, I think, male or female in the 70s, that it wasn't so much about boys and girls. It was just about being a kid. Like, I'm sure you've looked at this, even like, the toy aisles at that time, you go into a toy store and there wasn't like the pink section and the blue section, the way you see at Walmart now. Everyone just kind of played with blocks, and you did not have this, this sort of gender essentialism, as it would be called now, at that time. So I think for me, growing up at that time, it was a real gift because I never associated any particular behavior with being out of bounds with being female. I just thought, well, I'm this kind of female. And I actually also think that up until recently, if you were a girl or a woman, there was a much wider range of ways that you could present. Women could wear pants or dresses, and you could be kind of, athletic or masculine, and that was actually cool, and there was something sexy about that. Like, I always felt like there was a much larger window of presentation for females than for males. But I don't know, sometime in the 90s, suddenly everything was like the Disney princess aesthetic, and stuff got really narrowed, I think, in terms of gender expression. And I wonder if some of what we're seeing now in terms of the dysphoria, it is an outgrowth of that.
Oh, 100%. So you're essentially talking about the girl who isn't girly and thinks that's really cool, not wanting to be a hyper frilly girly girl. And this is what I hear a lot from young people, especially those who are a little bit older. I mean, we also see a huge number of kids detransitioning now. And when they reflect back on their experiences, they often will share stuff like that, that they thought it wasn't cool to be very girly, and it was way cooler to be a trans guy than just some nerdy, regular old girl. So I think, Meghan, when I first started to research what's going on, I felt quite disconnected from it. But the more I meet with these young people, the more I realize this would have been me. I would have been one of these kids. And what I really want people to understand is that growing up as a teenage girl is really hard. There's so much pressure to look a certain way and to fit in a certain way. And of course, there are special pressures boys face too. I'm not saying that only girls have a hard time. But when you're a teenage girl and you are also on Instagram and you have all of these hyper feminine, like very sexualized female kind of role models, and you're really trying to figure out where your place is, it's very easy to read the kind of concept of gender identity and this whole gender spectrum and to say, well, if I don't like this super girly persona, I might not be a girl after all. And a lot of times kids who start questioning their gender, they'll be looking at these materials online and looking at the gender spectrum, and they'll say, I don't know that I'm a boy, but I just know I'm not a girl. And what they ultimately mean by that is, I know I'm not this incredibly pretty, beautiful princess, kind of happy-go-lucky, smiling all the time, also sexually down for whatever girl.
So do you have conversations with your clients about this? Are you able to even kind of hash this out in this sort of way? Or are they even capable of conceiving what the possibilities are for being a girl?
Well, I think what ultimately I try to do is I try to understand that there's a need here that they're trying to meet through this identity. So, for example, if they are feeling very vulnerable to the kind of sexualized attention that they don't want, we talk about that feeling of being unprotected or wanting to kind of shelter yourself from those experiences. And we just explore that together. And sometimes that opens up, again, a little more curiosity about, how does presenting as a boy make you feel different? It's hard to tell kids, this is hard to believe, but when I was your age, this and this and this.
Right.
But we do discuss the fact that being comfortable with all of these very gendered norms is not an inherent part of being female. So I just try to help young patients understand that being uncomfortable is a natural response to something that maybe feels cringy to you. It doesn't mean you are born incorrectly. I may not use that exact terminology, but this is another problem that I have with a lot of aspects of the gender identity theory is that if you're uncomfortable, it means you're in the wrong box. And we know that's not true because anyone who's ever tried to grow up has felt a lot of gender-based discomfort, which again, it's different from someone who's had a pervasive sense of dysphoria since they were very young. These are kids who I believe are interpreting pretty normal teenage discomfort with gender dysphoria.
And does this sort of speak to these larger discussions? Jonathan Haidt, talks about this a lot, just the sort of discomfort with discomfort that we see in these generations for whatever reason. I don't know if it has to do with, parental, parenting approaches or being medicated, sort of being in therapy, since you're 3 years old. If there's, we're sort of pathologizing normal bad feelings and discomfort that we all have. Is that sort of playing into this?
100%. I mean, I think kids are primed to be searching for what is wrong and finding a label for it and trying to resolve it really quickly rather than making space for the discomfort of life. I know a lot of these kids have, of course, really well-meaning parents, but many of them have had very, very kind of sheltered and safe lives. Not always, like my population represents like a certain slice of the parents who are going to contact a therapist in private practice. I'm not saying this is true across the board, but, I do think a lot of kids today have the idea that life should always be pretty comfortable, aside from academic stress, which they are almost perpetually in a state of panic about. But there is this kind of obsession with self-diagnosis and trying to figure out what like mental health condition you have or what your problem is. And I think that really doesn't serve young people who are trying to develop kind of more of an innate sense of resilience and, problem solving skills. I don't think it's helpful. And I think you're right. It has a lot to do with the discomfort with being uncomfortable.
I'm wondering, in any one of these activists, I feel like there's probably a constellation of mental health issues, trauma in the past, any number of challenges, and gender dysphoria, trans identification is maybe just one of them. But somehow what's coming across in the activism has less to do with anything having to do with gender or trans, but just sort of just like discomfort and outrage and upsetness in general. So the activism really has to do with some whole other sort of presentation of, I don't know what the word would be, like upsetness. It's just, it's its own thing. And for some reason, it has been assigned to the gender discussion and advocating for trans people when it's really not doing that at all. So I guess that's just sort of a kind of circuitous, maybe avoidant way of asking, what is wrong with these people? Why are they so, I'll just say it, unhinged, a lot of them, and just allergic to logic and so unwilling to take in any kind of dissenting opinion. I mean, it really does feel like a religion. Beyond that, it feels cultish. I hate to put it in such blunt terms, but I will.
It's a really good question. I think there are probably different kind of tiers of activists. You have the casual 15-year-old who is on Twitter just calling everybody a TERF that maybe doesn't have any power to impact legislation or mental health guidelines or things like that, right?
And a TERF is... Then you... Explain to us what a TERF is.
Okay, so a TERF, the acronym is Trans Exclusionary Radical Feminist. I think this term originally came up when some radical feminists, which the word radical is meant to denote that they are looking at the roots of a problem, right? Not that they're just crazy.
Right.
So there's a certain branch of feminism that says, no, actually biological sex is the reason that women have been oppressed, and therefore a transgender woman who is a male who identifies as a woman does not get the same access to sex-based spaces or sex-based rights that women get.
And I would think most second-wave feminists would fall into that category. Germaine Greer has been one of the most outspoken in this sphere, but I would think exactly. Just about any of the women on Mrs. America, if anyone's been watching the Hulu series, would be TERFs if pressed, which they wouldn't have been. Okay,
but the term TERF, I mean, it is a slur, and I think it's expanded. So now people will call you a TERF, basically if you ask the wrong questions about trans issues. So it's really been another category blowout, right? I think that is like the theme of the day. Let's blow out all the categories. But anybody can be called a TERF if they ask the wrong kind of questions. So someone like J.K. Rowling, for example, of course, is now like probably the most famous TERF, but all kinds of people can be considered TERF.
For sure,
right?
Yes.
And I've seen trans people called TERFs who just have a different opinion or are asking important questions. So, I mean, there's so much absolute ridiculousness in the way this kind of all activism online works right now that people from the category can be called someone who is anti that category. So a trans person who is anti-trans, apparently. That's what the word TERF means. But to go back to your question about these activists online, I think one way we can look at this is that if you are a person who has adopted this idea of gender identity and you are claiming to be in a different category, you also have bought into this idea that biological sex is not real. So this is the new kind of frontier of trans activism, trying to flatten the distinctions between biological male and biological female. It's really important to understand that if we were to try and figure out why some of these activists are so intense. So when you flatten male and female into some kind of a sex spectrum, which any serious scientist and anybody who's been on Earth for more than 5 minutes can probably tell you, we know biological sex is real. The fact that we're debating that is kind of crazy. But if you are a person who has kind of adopted a different identity, and you don't want to acknowledge that actually, if I am a transgender woman, I am actually different from a biological woman. And if you're very insecure in your ability to call yourself a woman, you really have to shout down anybody who points out the biological reality of sex, or who asks important questions about protecting transgender women while also protecting biological women. I mean, so a whole slew of very reasonable concerns has to be dismissed if an individual person is insecure in their chosen identity. And I think that's part of the reason we see what you're kind of describing as like, what is wrong with these activists, or what's the mental health issue behind this? And I do believe part of it is feeling like they need to validate their authenticity as a woman by basically turning all of reality into a fantasy.
Right. And I think that, we need to be careful. People on Twitter may be the loudest, but they're not most people. So I think that there might be some causation versus correlation. If you're on Twitter yelling, that would probably correlate with not being secure in your identity, as well as any number of other things. So yeah, but
most trans people I've met just want to kind of live their lives in peace and are very cognizant of, trying to kind of blend in with the gender identity that they feel they are. And I do not think Twitter activists in any way represent the most common kind of perspectives of trans people or even of trans allies. I mean, they're just such a loud and boisterous presence on social media that it creates this illusion that all people who are part of LGBT are radical activists, which it's just not true.
But the problem is the institutions are taking their cues from this activism, the school curriculum, the training that you had to participate in. I mean, why is that? The activists seem to be setting the tone. For a lot of people in charge are paying close attention.
Yeah, but I think there's also activist academics, and they're not exactly screaming on Twitter, though they are, publishing research that really kind of misrepresents even their own data. They are making exaggerated statements, for example, about like suicide risk and suicide statistics. And they're doing this, under the guise of being reputable academics. But when even someone with kind of a basic statistics understanding takes a look at some of these papers, they see there's serious flaws, and they don't actually represent the data in a way that is clear or accurate or honest. So I think we have a combination of, loud voices on Twitter, and I think those people essentially scare the average person from sharing a thought or sharing an opinion, and they create the illusion that there's a consensus. And then, of course, you also have activist academics and activist clinicians and activist doctors who are really taking over the narrative and actively trying to get dissenting voices shut down. And I just think it's interesting to point out that these, quote, dissenting voices like my voice or Dr. Ken Zucker's or any of the kind of pioneers, these were, people whose opinions would have been considered incredibly progressive just like 7 or 8 years ago.
Oh, absolutely. Radical even. Yeah.
Mm-hmm.
So how is it that they've been allowed to take over like this? What is the actual, what is the process of somebody who dissents getting shut down? They don't get tenure, they get fired, they get ostracized within the community. I mean, what actually happens within academic and research circles that has allowed this particular cohort to dominate?
Well, I'm not an academic. I'm not a researcher. So I think there are other people who can speak, more eloquently about this. But I do know that some of the big organizations like WPATH, for example, they have really discouraged dissenting voices, and they've really adopted a stance of like no debate. It's kind of like what's happening with other social questions of the day. If you ask a question or if you raise a concern, you are accused of some kind of phobia, and that really does end up shutting down the debate. And I think when, if you were to take, let's say a younger clinician who wanted to learn more about trans issues, and they go to one of these conferences and they see that tone and they see the really intensity of dogma, they're going to be terrified to ask questions or think more carefully about this. And I think a great example is what's happening in the UK at the Gender Identity Service there. So there was a report created by Dr. David Bell with several clinicians from the service who had worked there for extended periods of time, discussing how their concerns about child safeguarding were either dismissed or not taken seriously. And many clinicians resigned. I think like 35 clinicians resigned from the Gender Identity Service there.
This is the Tavistock clinic you're talking about?
The Tavistock, yeah. And they were saying, I think we are medicating gay kids. I think we are medicating autistic children. And when they brought their concerns to their superiors, they were essentially told, not to look into it or not to explore it with the safety officer. So there seems to be this attitude of dogmatism whenever we see transgender medicine since the last, decade or so. And I don't really understand how we're supposed to effectively assess and treat patients if this is the attitude of the big organizations who are supposedly the leaders in, childhood gender issues.
Well, it's so extraordinary because it seems there's no precedent for this, really. I mean, we can talk about the multiple personality disorder, hysteria. We can talk about the recovered memory syndrome stuff that was happening in the late 80s, early 90s. But that, I think, there was damage done there, but the damage was like, I'm going to accuse this relative of having, raped me repeatedly when I was a child and blocked it out. And then it turns out that didn't happen after all. That's a terrible thing, but that doesn't compare to cutting off parts of your body and giving, medical treatment to children that is not necessarily warranted. I mean, is there any sort of analogy you can think of to any other kind of, occurrence in medicine or psychology in history?
Well, I mean, we have cases of lobotomy attempting to quote unquote cure people who have same-sex attraction. So gay and lesbian people have been subjected to some horrific medical experimentation. But I think on this scale, with this level of dogmatism, I cannot think of anything comparable. And it's really important to keep something else in mind. Identity is something that is formed in a cyclical manner, not just between you and your internal sense of self, but also you and the outside world. So you brought up this idea of surgeries and these medical treatments and the possibility of someone changing their mind. Well, what happens when a person transitioned at 13, let's say a female, and she at 22 starts to think back about her childhood or her trauma and realizes that this was a big mistake? She now looks essentially like a man.
Yeah.
And so if she wants to detransition and try to regain her identity as a woman, she's not only having to cope with like the entire 7 years of her life where she's lived, quote, as a guy, but she now has to navigate the world looking one way, but actually feeling a different way on the inside. So it's like a reverse version of gender dysphoria.
Yeah.
So the medical implications of this are so incredibly serious. not just because of the elevated risk of heart attack and all of the complications that can come along with it, but also what does this do to one's sense of identity when your outside is now completely transformed and you feel like that's wrong?
It's so tricky because, I mean, there is a level I can imagine. I mean, for instance, I can imagine being a boy, like a young boy who feels that I'm a girl really strongly and wanting to start medical transition and being absolutely aware of the clock ticking and terrified of hitting puberty and sort of getting past the point of no return when it comes to passing. I mean, you know, you transition before puberty, you're going to have a lot cosmetically anyway more successful outcome than if you wait. I can sort of, you know, I guess the teenage girl in me who's, you know, sort of terrified of my own you know, changing body relates to that kind of mindset, especially in, you know, if it's a male wanting to transition to female. But no, I absolutely I hear what you're saying. And I mean, do you think there are going to be lawsuits down the road with this? Are we going to, you know, a decade or so from now, see a slew of people, you know, going back to, I don't know, sue the clinics, sue the doctors because these decisions were made?
100%. I mean, we already see that there's a young woman who was treated at the Tavistock Gids who is also in proceedings right now, and they're looking at changing the age at which you can medically transition a child. And I think in the US, we are going to see a very similar thing. The clinics are operating based on an informed consent model, which means that, you know, as long as a young person has their parents' consent and they are told about the side effects, even at, you know, 15 or 16, then technically they are able to consent to these treatments. And you know, I don't know how we have squared that with medical ethics or with the idea of, you know, do no harm. But I do think that there are going to be lawsuits. I think what makes me concerned is I see this moving in the direction of a cosmetic procedure. That's what informed consent feels like to me on kind of a visceral level. From hearing enough stories, it feels like a cosmetic kind of venture. So if it is framed that way, which, you know, some of the trans activists actually explicitly say, you know, you shouldn't have to have gender dysphoria to medically transition. That should be your choice. And, you know, for adults who understand what they are getting themselves into and they understand the side effects, I don't know if that's that big of a problem if you really believe that, though I don't think we should ever think to apply that to children. But I do see this as being very cosmetic, and even some of the kind of leading activist clinicians that I've mentioned to you, Meghan, they say, you know, for non-binary kids, sometimes they just want a slightly masculinizing effect. So just a little bit of T, which is short for testosterone. So to me, that looks a lot like plastic surgeons or cosmetic, you know, aesthetic only medical procedures. So I'm really concerned about that because we are also, again, divorcing it from a condition that is inherently distressing, that requires, you know, treatment to help the person feel better. This is now kind of like, well, it's a consumer based, you know, whatever the customer wants is great, and we should just give them the medication if they would like whatever aesthetic effect it will have on them.
Sort of a made to order sort of model. You know, there's another kind of angle to this that's really dark. I mean, I think, you know, we think about these parents and these families, we think of this, you know, sort of in terms of like a, you know, kind of hyper progressive worldview. But I mean, there are parents who don't want their kid to be gay. And when confronted with this choice, would opt for gender transition rather than to have a gay kid. I don't know how common it is, but I think it's not unheard of. And I feel like, I mean, maybe you know this better than me. This could be wrong. I feel like I read a statistic like Iran or some country like Iran has the highest number of gender transition surgeries in the world. And, it's not because it's so progressive. It's because, it's illegal to be homosexual. So, I mean, is that something that you've run into?
Well, people who contact me are typically very comfortable with the idea that their kid may be gay. And that's why they actually want them to be careful and make sure that their gender dysphoria is not, internalized issues with their sexuality. But I do know from reading reports coming out of the UK and even some of the clinics in the US, there are parents who are more comfortable having essentially what is a very gender conforming trans kid than a non-conforming gay kid who is going to date, same-sex people. I'm sure that this is happening. And again, that's kind of the problem with this whole theory of gender identity, is that it's inherently going to trample on a healthy sexuality development.
This may seem like a little bit of a sideways question, but since I have you, I can't help but ask it. We know this is a social contagion in terms of popping up in clusters and school groups, peer groups. But does this run in families at all? I can think of a few examples of families where a parent transitioned and then a child either transitioned or started identifying as non-binary. Is that something you've run across?
Yes, I have. I've seen the social contagion spread across siblings. I've also not personally worked with families like this, but I know of families where a parent starts questioning their identity or kind of introduces the idea of gender identity into the family. And then, lo and behold, a bunch of their kids are also transgender. So again, that's why I try to distinguish this from organic gender dysphoria. I think you can make a really clear distinction between somebody whose gender dysphoria just emerges on its own versus somebody who learns about the concept of gender identity and then starts to question their gender for the first time. So it wouldn't surprise me, if a parent is questioning their own gender and researching this concept, that if they, teach it to their children or apply it to other kids in their lives, that, they might read that gendered behavior. So if they have a daughter who really likes to play soccer, they might kind of bank that in their mind and say, I wonder if my daughter's, trans masculine or something.
Or if the parent is happy. I mean, the cases I'm thinking of, the parent transitioned at a later age, in middle age or something, and is really happy about it and thriving, and in some cases still married to the original spouse and the family's intact. And so, hey, why not? What a great example. And maybe it is right for the child to transition. I don't know one way or the other, but yeah, it's something I've noticed. So I guess to wrap this up, where do you see this all going? Is this a sort of cultural spasm? What kind of legs do you think this all has? Are we going to still be having this conversation in 10 years, 15 years?
That's hard to say. I know that in the time that I've been working around this issue, I've seen a huge number of young people detransitioning and starting to share their stories. I've also seen more and more clinicians and doctors and teachers and professionals also kind of taking note of what they're seeing in their client populations and starting to speak about their experiences and raise their concerns. So I think we're kind of at some sort of a tipping point. It's really hard to ignore stories of detransition and of young people who, in their own words, feel really harmed by the affirmation model that really pushed them through the process quickly. So I think these stories are going to have an impact on public perception about affirmative care, and hopefully will cause clinicians and doctors to really pump the brakes when they make treatment recommendations for dysphoric kids.
So my last question has to do with the fact that at one point this show was going to be called The Problem with Everything. It's now called The Unspeakable, but it was called The Problem with Everything for a while. I ended every show by asking my guests what they really think is the main problem with the world? What is the problem with everything? What is the thing that we do to screw up our lives or just sort of get things wrong? And you can answer this in the context of the subjects that we've been talking about or just more broadly. What is sort of the root cause of our distress?
Oh, this is such a great question. Well, I have really come to believe that a major cause of our distress is our disconnection from the physical body and physical reality. I think we spend so much time fully immersed into two-dimensional online worlds that cause us to be completely cerebral and up in our heads all the time. And we forget that beyond the world of thoughts and ideas and language, there is a three-dimensional reality that is interesting and gives us valuable experiences and can teach us a lot about how to be in the world in a way that is not purely intellectual. So I think getting off screens and into the real world and being connected with people in 3D and being connected with our bodies in physical movement and in a kind of compassionate way towards ourselves is really sorely needed.
Sasha, thank you so much for speaking with me. It's been really interesting, and I appreciate your work and your insights and your taking the time.
Thank you, Meghan. It was really great to talk with you.
That was my interview with licensed professional counselor Sasha Ayad, recorded on June 25th of this year. You can subscribe to the podcast on iTunes, Spotify, Stitcher, and Google Podcasts. And for more information, you can visit theunspeakablepodcast.com, and you can listen there too. I hope you'll tune in next week. I'll announce the guests very soon on the website and on all the usual social media spaces. Thanks for listening. See you next time.